Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. We have a couple of the state's leading reporters. We're going to get into the big stories of the week, but first, the opioid epidemic. Imagine this, 10 Pennsylvanians a day die from opioid abuse. We'll be back with that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. We're going to take a few minutes today, and we're going to talk about the opioid epidemic. As I said, 10 Pennsylvanians a day die from it. It's a serious problem. In fact, it's an epidemic. Joining me to talk about that is Dr. Charles Cutler. He's the president-elect of the Pennsylvania Medical Society, and Gary Tennis. He's the secretary of the Pennsylvania Department of Drug and Alcohol Programs. I think I got that right. I mean, I must tell you, the more I read about this, gentlemen, the more I'm stunned at how this situation has grown. And I know both of you in the department and you in your organization, you're working very diligently. And the governor has weighed in, state lawmakers. This is not a party thing. For once, we have something that we can talk about that everybody's invested in. So let's go through, what can you do to make your lives straight? I'm looking at our viewers out there. What can they do?
Well, first of all, understand that this truly is a threat to all of us. I don't think there's a family in this state right now that hasn't either had a loved one suffering with this or has a family they're close to. So there are steps that a family can take. Right now, we know that a lot of our young people get involved because they take opioids left over that are unused out of people's medicine cabinets. It used to be okay. There was a time in the past when it was okay to leave those leftover opioids if you had them.
And who hasn't done it?
Everybody's done it because you don't want to go to the emergency room on a Sunday afternoon when you hurt yourself playing ball with the kids.
But they're also expensive, so you don't want to throw a few of them out, right? And if you
leave them in your medicine cabinet today, you are putting our young people's lives at risk. So we've worked up a program where we have take-back boxes that are placed in police stations all over the state, hundreds and hundreds of them. In fact, with the National Guard and the Attorney General's office, we've collected over 100,000 pounds of prescription drugs.
Wow.
It is critical that if you have leftover unused opioids or benzodiazepines, those are the tranquilizers, in your medicine cabinet, you've got to get them out of there. And you can go on our website, and it's DDAP. Just look up Pennsylvania Prescription Drug Take-Back on Google, and it will get you there. It will tell you where the nearest take-back box is. You need to take them to the take-back box. Flushing them down the toilet is not a good option because they go into the water supply, and then they don't get filtered out, and then we all get a little of them, and we don't want that either. They need to go to the take-back box.
Yeah, we're going to continue with these, but I want to turn to you, Doctor. What's the medical? I know this has been a major priority for you. Go ahead. Terry, you've convened working groups. Go ahead. Talk.
Right, Terry, this is certainly a top priority for the Pennsylvania Medical Society. We have a program, we call it Be Safe, Be Smart, Be Sure, which is a public health initiative geared towards our patients and towards our physician members. To better educate patients about the dangers of opioids and to help physicians better prescribe these agents. I'm a primary care doctor, and I see patients every day with acute pain and with chronic pain. And the first thing that often goes through their mind is, can I get a prescription for a quick fix? But there are better ways, more effective ways to control both acute and chronic pain than immediately going to an opioid. And we think we have to get this message out.
And I presume that medical education going on in the medical schools today is really going to start to emphasize that more than ever. I mean, go ahead.
That's right. And the Pennsylvania Medical Society has reached out to the medical schools, to the deans, to make certain that the education that the medical students is receiving is right up to date about the dangers of these products.
The Medical Society has been a tremendous partner with our Department of Drug and Alcohol Programs and Department of Health. We've worked closely on developing, actually we're the only state that's developed discipline-specific prescribing guidelines, 7 different sets. we've done with the Medical Society. No other state's done that.
Wow.
We have been working, we have regular meetings with all of the medical school deans. Dr. Rachel Levine has really headed that up, but we're part of that as well, not only to strengthen the curriculum on dealing with pain, but also to start to train doctors in how to identify people that are getting a substance use disorder and how to get them to specialty care. That's really critical. Right now, they don't pick it up because they're not trained.
We only have about a minute left in this segment. We'll come back. We're going to continue this. But you've also worked with schools and law enforcement, right? You've increased your efforts to work with folks in those communities, correct?
Yeah, and credit goes to Secretary Levine for allowing naloxone now to be widely available to police officers in schools and other public health venues, because a medication like Narcan, which is the brand name Narcan, it is easily available.
That counters the overdose, is that correct?
Saving lives, yes.
It reverses it. So what it causes, if somebody's dying, or sometimes even after the heart has stopped, if you can get there within a minute or two, if you administer, it either comes in a nasal spray or there's an auto injector. It has no side effects except that it immediately reverses the overdose. The person goes into sudden withdrawal, so it's unpleasant.
All right, we're going to run to a break. We're going to continue. There's some other very important points that my guests want to bring out here, and we'll get to that in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, now celebrating 100 years as the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
My guests are Dr. Charles Cutler. He's the president-elect of the Pennsylvania Medical Society, and Gary Tennessee he's the secretary of the Pennsylvania Department of Drug and Alcohol Programs. All right, Dr. Cutler, if this problem is going to get resolved, there's really two big pieces to it. One are the physicians, obviously, that prescribe the drugs, and others are the patients who take them. And then what happens after that, as both you and Gary Tennessee have been talking about. Let's talk about the continuing education. This is an important piece of it, isn't it?
It is, Terry, and the Medical Society is really all in on this top priority, solving this crisis. We've addressed it both towards our physician members and towards the public. We've created many educational opportunities for patients. Posters that we hope physicians will put in their waiting rooms, in hospital lobbies, etc., that would educate our patients about the problem. But we've also worked with the Department of Health and created some terrific guidelines, general guidelines on how to prescribe opioids, keeping the dose low, talking to patients about other options, keeping in mind contraindications, reassessing the dose after a certain period of time.
This is a tough problem. You get a patient, you're a physician. I've been, and Gary, we go in, we have a lot of pain. And you look at us and, you want to relieve us of the pain, right?
There are other ways to deal with it. Right now, I have back pain. I have sciatica and herniated discs. So I have an electronic stimulation unit I bought at the drugstore. It works.
Oh, good.
I put ice on 10 minutes every hour.
I get it.
I've come up with my own solutions, but I'm not taking opioids, because if I took them every time my back hurt, I would be addicted. I'd probably be using heroin today. There are other ways to deal with the pain.
Yeah, you agree with that, right?
I do, Terry, and there are a lot of folks that are on opioids chronically, and we are encouraging them to rethink those medications. And we're working with the Department of Health to seek more opportunities for chronic care for the addicted patients. We need parity with our health insurance providers so that there are ample mental health opportunities for patients, outpatient and inpatient treatment centers, so that patients that are addicted to opioids can get the help they need.
Now, are there tough insurance problems with all of this?
In the Medicaid area, but the one thing I want your viewers to know is that people do get better in treatment, and if they have help, they can go to our website and there's a map they can link, they can easily find where to get help. We have 23 million Americans in recovery, but that is being placed in jeopardy in the context of Medicaid. Right now, there is a rule that the Federal Department of Health and Human Services is proposing to limit Medicaid coverage for residential treatment to 15 days a month.
Right.
Now, 15 days for someone with a serious heroin addiction. I was going to say,
common sense.
Not even close.
I'm a doctor, but a different kind. Nobody's going to ever come to me for medical advice.
Right.
But even I would think that's not enough.
No, it's a dangerous dose of treatment. You get 30 days if you come in on the 16th of the month. If you want to hear an Alice in Wonderland rule, that's arbitrary and capricious from a legal perspective.
Yeah, I get it.
So that needs to be gone. There needs to be the federal law, the parity law that just was passed, mandates that we treat drug and alcohol treatment like any other disease. And that means you get what you need clinically. This is called the IMD exclusion.
Right.
It stands for Institution for Mental Disease. It was meant to stop the warehousing of the mentally ill that used to occur in the 60s and 50s. It does not apply here, and somebody should be able to get what they need. So for someone with a serious heroin addiction, they might need 3-4 months, 5 months residential treatment, followed by a year of outpatient. So good point. This IMD exclusion's got to go.
All right, listen, we're out of time. Here's what I'm going to ask you to do. Let's do a little update on this, because this is something that is not going to go away overnight. There's legislation going, that's moving through the legislature. The federal government, to some extent, is involved in this. This is an important issue, so we'll have you guys back, and we'll get a good update. All right, big stories of the week. It wouldn't be Pennsylvania politics and government if we didn't have one big story to talk about, and maybe two.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit betterwithcoal.com.
Well, welcome back to the program. Joining me is Robert Swift. He's with Times-Shamrock Newspapers, and Marc Levy. He's with the Associated Press, two reporters that cover Pennsylvania politics and government. All right, I'm going to put up on the screen something called the Legislative Correspondents' Roast. And this is occurring on September 27. You heard of the gridiron in Washington. Everybody gets roasted on these things. Here it is. It's September 27. You want to come? It's an off-the-record roast. You guys have anything to say? Want to say anything? Add a word about it?
Well, the governor will be there. We'll have some lawmakers there, and it should be a good, funny, off-the-record night. And,
yep.
We do
so
it
there you go, and it's
fundraiser.
Open to the public, right?
Yep.
And what's good about it is the proceeds go
to support legislative interns.
Yep, scholarships for legislative interns. That's right. The future of the reporters is in your hands, right? That's
the reporters are young journalists that we're training to grow up and be big journalists.
Big journalists, I got it. All right, you heard us talking about this opioid situation, a lot about the medical and what's going on, but in the legislature itself, there's some activity. Robert, let me start with you. The governor has called a joint session. Let me get it right. He's both in the same room. Same time, and he's going to do what?
He's going to give a speech, and he's going to focus on what bills that he thinks they can get through in the limited days they have, and they seem to be focused. The focus seems to be on the medical professionals trying to do stuff, incentives and other things to educate them to stop overprescribing painkillers.
Yeah. So you've actually written about this, right? Mm-hmm. So what is there anything in particular about them that you would point out to our viewers?
Well, what the Associated Press and the Center for Public Integrity did a national project just this past weekend talking about how the pharmaceutical industry has worked in Washington, D.C. and in state houses around the country to battle against any effort to limit the prescription of opioids.
Right.
Right now you see a lot of this going on in state houses where there is an effort to deal with this what we hear is a very serious drug epidemic, perhaps the most serious we've ever faced. And it comes at a time when Pennsylvania is trying to marshal a strong response to it, and we should see some legislation coming through the State House this fall. The governor has a number of priorities. One is to limit prescriptions by emergency doctors to 7 days. Another is to require doctors to check a database every time they fill out an opioid prescription.
All right, I want to turn to another. I'll start with you. Let's go back to you, Robert. There's a State House member from Philadelphia, Leslie Acosta. She actually pleads guilty to a felony earlier in the year. You finish my thoughts on this.
It's sort of amazing. It was a federal case involving her work with a nonprofit in Philadelphia. And what's amazing in this, that it's now 6 months later, it's only came out in an election year. She's been on the ballot running opposed. No one had an opportunity to even, enter the race, voters to run against her, maybe given a choice.
It's amazing.
And thus the other thing, this was under seal by the courts. So the federal, normally when there's someone, is charged, the federal U.S. attorney puts out a press release, or it's on their website.
Yeah.
So it baffles me. One question I would have is, don't they have any respect for the voters in this kind of thing?
Yeah, this is and the fact of the matter is that is anybody working out of her office in Harrisburg? She's showing up, but
she's been on leave this week. So this first came to light on Friday when the Philadelphia Inquirer found some of the court filings and cited sources in saying that she had secretly pleaded guilty under seal. That was the first word that basically anybody knew about it. Democratic Party leaders, top lawmakers in Harrisburg said they knew nothing of it.
And Bob Brady, the chairman of, go ahead.
Yeah, and the Democratic Party, Bob Brady, the Philadelphia Democratic Party chairman, wants Acosta to resign so that they can try to get somebody else on the ballot. Now, Acosta's lawyer is saying that she will not resign. She hasn't been sentenced yet.
Yep.
And in theory, I guess case law holds that you're not technically convicted
until you're sentenced. All right, we're going to run to a break. Stay with us. We're going to something interesting we're going to chat about. We'll tell you about it.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
I'm joined by Robert Swift, Times-Shamrock Newspapers, and Marc Levy, Associated Press. All right, there's this controversy, Mark, over who can sue when municipalities pass gun control laws that exceed what the state permits.
And we're seeing this resurface now in this fall session of this brief fall session, pre-election fall session of the legislature. This is a law that was essentially struck down by the state courts after Governor Tom Corbett signed it in 2014. It was struck down on a technicality, so not because of the substance of the law, but it essentially expands the field of who can sue a municipality. And this goes back to a complaint by gun rights groups that municipalities are able to pass laws, ordinances that exceed state law on gun control and are, theoretically illegal, but there's no one who has standing in the courts necessarily to sue.
Right.
And
one of them had to do with, I think it was in Lancaster City, about when you could report a gun law, maybe not in Lancaster City, but somewhere. If it was lost or stolen, you had so much time to report it. You know what I mean?
A number of municipalities had, and maybe still have, laws like that on their books. And either a House committee brought out this bill. There's one in the Senate. And now Governor Tom Wolf did not support this when he was a candidate running in 2014. He said, I don't support that. If it gets to his desk, presumably he'll veto it. But the question is,
get the pen out, right, and veto it.
The question is, though, whether it will have a veto-proof majority in the legislature.
Can municipalities go beyond state law, and who can sue? That's sort of the big. Robert,
It's a long-standing legislative tradition, should I call it, where they go in and try to rein in. It's supposed to be local power state, but where they try to go in and restrict local governments from doing stuff.
Yeah. Well, before we let you go, if it's silly season in politics, to some extent, it can be silly season in the legislature where they pass all kind of bills that go ahead.
You're right. What we're in now is called the pre-election session, and really the focuses on. They don't want to do anything too controversial.
Oh, no.
At the same time, this week the House passed some bills to help veterans and military personnel. I think one was to make it easier for an active military person to run for public office without residency requirements.
Yeah.
That sort of thing, appealing to strong constituency groups.
Right.
Plus, there's a lot of lawmakers, the ones who do have races, they're trying to advance their bills.
Something that they can, But some of them aren't bad. It's not that it's bad legislation sometimes. I mean, maybe some of it ends up not being, as Robert points out, something for a small group of people. But overall, they're not doing very much that's important, right?
As Robert said, they're going to stay away from the really divisive stuff. So you're not going to see a tax increase this fall.
Yeah.
You're trying to erase the memory also of last year's budget stalemate.
Great point.
Some of this budget on the painkiller, the bipartisan glow you hear is trying to divert attention from that.
Yeah. So in the end, relatively little is going to happen. They're only in about whatever it is, 12, 14 days together. It's really going to be about the next session, the next legislature, right?
Look, they have some big things hanging over them. They have a gambling expansion bill that they're working on. They have major pension legislation that they're working on. The question is whether this fall session is long enough, and whether these guys, if their attention span during the election season is long enough to deal with it.
Let's be honest. They went out of Harrisburg. They won a campaign, even though a good many of them either don't have serious opponents or don't have any opponents at all. All right, thanks for coming in. Great update. We'll see you soon. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.